Now we're going on to the next big bang, and that is cardiovascular system. This, get ready for some extensive changes and some new vocabulary to our CPT language. One is dialysis circuit. I've noticed they're trying to clean up this area, and they're trying to consistently use the same terms. But when I have to tell you, when I first saw dialysis circuit, I started calling it the dialysis circus. You'll have to forgive me. It came slipping out a couple of times. So if I say circus, it really is circuit, 36901 to 36909. So let's look at these codes, discuss them, and keep in mind these we're just dealing with patients that are on hemodialysis, and they need some sort of intervention. And remember, the goal with the dialysis is to remove the waste, and when the kidneys can no longer function. So I just put a little diagram in here so that you can visually see how hemodialysis is performed, taking blood from the vein, filtering it, returning it back. And this leads to an important explanation on AV grafts versus AV fistulas, which happens to be one of my sticky points these days. A little quick review to make this all the more sense. Arteries carry blood from the heart to various locations of the body. You probably all don't know that. And the veins carry deoxygenated blood from the body, except for the pulmonary vein. Arteries are strong. They're thick, they're elastic, they're muscular, but veins not so much, and they have a lower pressure. So what happens with hemodialysis is the constant puncturing of the veins can't be tolerated. So the doctor will perform what they call an AV fistula or AV graft, and they'll connect the artery to the vein. And we laughingly explain it as taking it to the gym and beefing it up so that it can take repeated punctures. And here's a picture of an AV fistula. This is the first choice that physicians like to make, is to use your own body rather than using something artificial. They connect the artery to the vein, and so that it's the patient's own tissue. There's less clotting, there's less infection. The only bad news with this is it takes a long time to be matured. So if the patient can't have that wait of several months, then they might have to go to a graft. Before I go on to the picture of the graft, just let you know that I see most of the time the arm. The wrist, they start the wrist and go up, and they connect like the radial artery to the cephalic vein, and this is creating a conduit. Some of the confusion that comes with this is doctors will use the word AV fistula and AV graft interchangeably, and it's not, and CPT doesn't help us with that. So I thought I would use this audience today to kind of help differentiate between what's a graft and what's a fistula, no matter what the doctor dictates or redictates both terms. The difference with the graft, you'll see in this picture right here, is they use tubing. They don't have, this one doesn't need as much time to mature. So if the doctor needs to go to the store and get a piece of synthetic tubing to connect the artery to the vein to make that conduit for hemodialysis, then they might have to do that. But this is definitely the graft, not a fistula. If you have your CPT book in front of you, and I have the, what do you call it, the professional edition. In 2017, and just like in 16, this is page 245. The top of the page on the right-hand side, they kind of call everything a fistula, and it confuses the industry. I wish they would fix that, because there's a difference between the graft and the fistula, and the codes are differentiated. So let's look at, and this has not changed. I don't want to scare you. You still have the open thrombectomy of an AV fistula and AV graft. The insertion of the AV graft and fistulas have not changed. The thrombectomy for open procedures have not changed, and they're on this screen right here. You differentiate the codes between the graft and the fistula.